Let me talk for a few moments about our founder, Dr. Carl Morrison. I didn't know him, even though I've been at Morrison for going on almost 25 years. But he was the visionary, along with some other very dedicated community members and fellow physicians, that started Morrison Child and Family Services that we know today. It was originally called the Portland Community Guidance Clinic, and it was created to develop services that would address mental health issues for kids. What we've been serving consistently now for the last 9 years that I have been Morrison CEO have been in the 7,000 to 8,000 range. And when you add in all of the siblings and the parents and the grandparents, it's many thousands more that we affect and help each and every year.
My name is Ann Morrison McCarthy, and I now live in Southern California, but I grew up in Oregon. My father came in 1947 when I was 2 years old, and he was the founder of the first child guidance clinic in the state of Oregon. In fact, he was the only child psychiatrist in the state for many years. Sometime around the early 1940s, they decided that, in fact, children were really different than adults when it came to dealing with emotional problems. And they decided that they would begin training doctors and healthcare professionals, a whole new subject called care of children, and really focused on that. He really felt that there was a generational problem. If families had problems on different levels, those would be passed down to the next generation and the next generation. And he really felt that they could, with their team working together, they could make an impact on a child's life to make a significant change. Besides being very kind, he was a very determined person. He was not naive. He did not think that things could be perfect. He didn't go for perfection in life, but he always felt that things could be better. And that's something that has stuck with me, is that you just never stop looking for a solution. He came at it from all sides. Besides being involved with people in the clinic, he really wanted to have a multimodality approach. His spirit is still in Morrison from the kinds of things that are being done and accomplished there, because he was just that kind of person. He was just a can-do, whatever we can do, we're going to do it, and I'm going to attack it from 6 angles. And it's I kind of had this image of him when I was growing up, that he was always in his car. He was at his clinic, of course, but then he was at the children's home, or the court, or teaching, or with families. And I had this vision of him, even though I wasn't there, of him being very active. He was he wasn't going to sit in his chair and nod. That he wasn't that kind of a therapist at all. He was proactive and looked for every angle that he could build on. Build on the positive is what he always said. If you don't have very many positives, everybody has a positive. Everybody has something within them that you can highlight and help them feel good about, and then they can build ladders from there, and then their ladders are only going up. And that's just was his attitude.